Hi guys, and so it begins. The Observer ran this story for the Sunday edition. NHS hospitals push private route to quick and easy care. What are they talking about? Well, pay up and avoid the queue. The paper gave a few examples here. Hip replacements from £10,000, cataract surgery from £2,200, hernia repairs for £2,500, and MRI scans from £300 to £400. The NHS waiting list currently stands at about 7.2 million. Now, while the Tories will blame the pandemic, it was at record levels before COVID hit. The paper also highlighted how a two-tier healthcare system is forming. It said East Sussex Healthcare NHS Trust has thousands of patients waiting for diagnostic tests but offered fast access to scans through its private division. Great Western Hospital's NHS Trust in Wiltshire is warning patients that services are extremely busy. At the same time, its private division promotes self-pay treatment for those who don't want to wait for an NHS referral. And finally, James Paget University Hospital's NHS Trust in Norfolk has been advertising private services on its website, telling patients, we provide highly experienced consultant-led services without the waiting list. One trust that has 7,800 patients waiting for diagnostic tests has said that if people are willing to pay £379, they can have it done in 48 hours. Now, trusts are promoting private care as a solution to the waiting lists and are saying that any money collected from those who can afford to pay will be reinvested in the trust. But with more and more people being forced to pay for treatment to avoid the growing queues, this will encourage for-profit organisations to jump on board as they will see a market for their services. And this will create a two-tier system where those who can't afford treatment will be stuck on a waiting list for weeks and months, while those who can will be seen immediately. This will result in lower investment in the public service, and if the NHS isn't able to pay higher wages, it will see more and more of its staff shift to the private sector. And this is not an accident. It has been done slowly but surely since the John Major years. It started out with outsourcing of cleaning staff and hospital porters and is culminating in NHS trusts advertising private treatments on their own websites. The poorest in society have always been beaten down by the Tories and convinced by their friends in the media that their enemy is never the rich and powerful, but the poor and the vulnerable. And I fear the next step in this saga will be the promotion of private healthcare insurance along the lines of an American model. This could have all been avoided, but the people who wanted it to happen are currently in the driving seat. And it will be sold as a solution for the millions on NHS waiting lists. I wouldn't be surprised if it's used as some sort of victory by Rishi Sunak. But it will mean another step towards a healthcare system where if you can't pay, you die. Let me know in the comment section, guys, what you think about all of this. As always, your comments are greatly appreciated. Thanks a lot.